Welcome back to Level Up Your Hip Mobility Part 2. In this video, you'll see a progression from our first video in which we're progressing from flexibility to mobility. Mobility speaks to the working through the full range of motion of a singular joint, as well as the strength required to work through that joint. So here you'll see me demonstrating some exercises where I'm working on the hip joint in 3 different ways. Let us know what you think. As always, please check it with your healthcare provider and physical therapist before beginning a new routine like this. In this video, we're working to directly mobilize the hip joint as well as the muscles of the inner thigh called the adductor muscles. Start in a tall kneel position with one leg out on a diagonal in a kneeling position and the other leg straight down. Hold a weight about 10 to 15 pounds at your pelvis, or you can hold at your chest. When you're ready, you're going to shift your weight out to the leg. Hold the position as you give a big exhale and notice if you sink further or not. And then you're going to shift your weight back to your starting position. We want you to slowly move in and out of this position. Notice that as you continue, your inner thighs will feel more limber. Again, slow and controlled, shifting that weight out to the extended leg and back to the starting position. Nice big exhale to let those muscles relax as you shift your weight out. And the number of sets and reps shall be determined by your physical therapy evaluation. Now moving on to the reverse clamshell. This is a great exercise for both hip mobility and hip strengthening. You're going to start by laying on your side with your hand underneath your head, fully extended, whichever is comfortable for you. We want a straight line from your head all the way down to your knees with your knees being bent. You're going to lift up the top leg and let it float in the air as if it's drifting on a table. Rotate that top foot up towards the ceiling and back to a neutral position. This motion should be slow and controlled without any femur movement, so that thigh bone should really be as still as possible so that you can practice control within that range of motion. Now we'll show you from another angle. Make sure that you have the proper mechanics. Again, a straight line from your head to your knees. Top leg is lifted. That foot is rotating up towards the ceiling and back towards neutral. Slow and controlled without a lot of movement in that thigh bone. The number of sets and reps shall be determined by your physical therapy evaluation. This exercise is called a hip CAR, which stands for Controlled Articular Rotations. Start on your hands and knees with a neutral spine. Keeping your knee bent, you're going to move your foot up towards the ceiling. Rotate the knee out towards the side, around like a fire hydrant and back to the starting position. And then you're going to slowly reverse. Notice that as I'm working through this position, there's little to no movement in my back. All of this leg movement is really coming from the hip itself, which helps to isolate the muscles and the joint we're trying to affect. Your motion may not be as big as my motion. That is okay. The more that you practice, the better this will become. This exercise takes a lot of focus. Most patients will say it can also feel like a brain drain because there's so much focus involved. That's okay. Again, it will get better with time.